All right, thank you so much for the introduction, Annika. I'm really happy to be here. Thank you to our sponsors. Thank you to everybody for sticking around for this last session as well. And I am here to tell you about our key milestones and give you a high-level overview of our qualifying submission and semifinals process. Those are two key major milestones of the competition. So I'll start by reviewing where we are currently at and remind everyone of the timeline and format of XPRIZE Healthspan. So XPRIZE Healthspan will take place over 7 years with 2 milestones along the way. Milestone 1 is the qualifying submission, application, and judging, and milestone 2 is the assessment of finals testing. Right now, we are in our primary registration and qualifying submissions phase, during which interested teams can sign up, they can register for the competition and submit their qualifying submissions, which if you haven't heard the date, December 20th enough yet, that is when they are due. Teams need to submit a qualifying submission to be eligible for awarding of the first interim milestone award. Following judging of qualifying submissions, teams will move on to semifinals, during which they will conduct early stage proof of concept studies. So this brings us to our first key milestone, qualifying submissions. What are they? For XPRIZE Healthspan and for the FSHD bonus prize, it is the first formal opportunity for prospective teams to demonstrate their ability to proceed through the competition successfully. This applies to both Healthspan and FSHD bonus. It's also the submission that judges will use to determine which teams are awarded and share the $10 million Milestone 1 award for Healthspan, and which teams will share the $2 million FSHD Milestone 1 award, so up to $250,000 per team. The application itself is 12 pages long and will provide a summary, a description of the team, environment, and clinical center that they plan to engage, and a more detailed technical application where teams will talk about their approach to semifinals testing, the scientific rationale behind their therapeutic, and provide preliminary evidence that supports use of that therapeutic on relevant endpoints and biomarkers. We're also going to ask for an assessment of safety and potential risks and benefits to human subjects, appropriate regulatory approval or evidence that regulatory approval will be obtained if necessary, and a statement describing scope of funding and the intellectual property for a team's proposed solution. Again, these are due December 20th, 2024. So as I stated, as part of the technical application, teams are required to support preliminary evidence in support of use of their therapeutic. So what types of evidence can be submitted? Secondary research, preclinical studies in animal models, clinical observations in patient populations, and in silico research are all appropriate and acceptable supporting evidence for qualifying submissions. Teams do not have to come in with pre-existing clinical trial data as a part of the qualifying submission, but if they have it, they can use it. If teams are interested in competing in both tracks, they must have a qualifying submission for both Healthspan and FSHD bonus prize. And Jamie and Dr. Eva Chin have both mentioned that teams interested in participating in Healthspan can also switch to the FSHD bonus prize track at no additional cost. Important dates to take note of: December 20th, qualifying submissions are due, and then the following month, XPRIZE performs an administrative review of the application, and then judges, a team of 9 to 11 independent judges, will review and make a decision about Milestone 1 awards in March 2025. And separate judging panels will be convened for Healthspan and FSHD bonus prize. Judges will consider and evaluate each of the criteria on the screen in determination of an overall scientific merit score, but there'll be a separate score for each. In the qualifying application document, which is located on our prize operations platform, currently available to registered teams, there's extremely detailed information regarding judging that all teams should read and incorporate into their qualifying submission applications. Based on the qualifying submission, up to 40 teams will be selected to share the $10 million Milestone 1 award for Healthspan, and up to 8 teams competing in the FSHD bonus prize will split a Milestone 1 award of $2 million. It's important to note that if teams are not selected as a Milestone 1 awardee, they may still continue on in the competition. They just need to talk to the XPRIZE team to determine the best pathway forward. After qualifying submission and awarding of Milestone 1, teams will advance to semifinals testing. Note, though, that there is no semifinals testing for FSHD. Teams will advance directly to the finals. All right, so this brings us to semifinals testing. And during semifinals testing, teams will conduct early-stage proof-of-concept clinical studies, which are typically short, small, help justify larger trials. And Dr. Brianna Stubbs is going to talk and give a great example right after I finish of what this would look like. For Healthspan, and this applies to Healthspan only, these proof-of-concept trials indicate readiness and feasibility of approach. That's what they're used for. At this time, teams are expected to engage the clinical center that will be used in finals and conduct a small study to demonstrate the likelihood of successful completion of a one-year clinical trial during finals. So this is qualifying submissions and semifinals. This is a runway to get you through to finals. And here's a list of what the semifinals can be used for. But I do want to mention that we allow our teams flexibility in defining what their early stage, the key features of their early stage trials look like. So this means that teams can propose their own study designs, endpoints, and assessment measures and criteria that will help support their go, no-go decision-making. Teams will be responsible for submitting regulatory approval, engaging a clinical center for testing, acquiring and administering the therapeutic solution, and also submit reports to XPRIZE. And this is the opportunity to demonstrate that it's feasible to enroll and retain participants meeting the specified inclusion and exclusion criteria. So ultimately, data should support planning, logistics, and infrastructure for one-year clinical trials that will take place during finals. At the end of semifinals, which conclude in April 2026, teams will be expected to submit recruitment and enrollment reports, analysis and data reports, a de-identified data set, and a finals application. And this final application will be available prior to the start of semifinals, so you can use it for planning purposes. In terms of timeline, this means that teams will have approximately 1 calendar year from the awarding of Milestone 1 or the decision-making for Milestone 1 in March 2025, all the way to when semifinals conclude. Similar to qualifying submissions, there are judge criteria that our panel of judges will use to evaluate teams. Teams, in addition to this list, teams will need to provide judges with de-identified raw data. Up to 10 teams will be chosen as finalists and share a Milestone 2 award of $10 million, so up to $1 million for each awarded team. Like the qualifying submissions, teams can still choose to continue on in the competition even if they are not selected as a finalist, but they need to work with XPRIZE and our team to figure out how to determine the best pathway forward. So to recap, qualifying submissions describe the team's therapeutic solution, their supporting evidence and the strengths of their team, plans of engaging a clinical center, and proposal for semifinals. And then semifinals will see the teams carry out their proposed testing in early stage studies. So official next steps, December 20th, that date, that's our qualifying submission. That is the most immediate deadline. And if you are interested in participating, please visit xprize.org/healthspan, click on register a team, sign up today. There are lots of benefits that you get as signing up. One of them is engaging with the XPRIZE Healthspan as a team. So anybody can reach us via email. If you're a pre-registered team, you can join our Slack community. We've also been hosting bi-weekly office hours for our pre-registered teams. We can also help you connect and find partners and resources. And we are also going to host workshops so that teams can learn about all things related to XPRIZE Healthspan and FSHD bonus prize. If you are interested in talking with us here, please sign up for our office hours or visit us at our booth outside. We would be happy to talk to anybody. So thank you for your attention.